So I'd like to start by acknowledging that a lot of this work was done on the lands of the Ngunnawal and Ngambri people, and I'd like to pay my respects to their elders past and present, and to extend that respect to any Aboriginal, Torres Strait Islander or other First Nations people who are here with us today. And as I've said, I'd like to extend that also to the traditional owners of the Scottish lands, and note that I don't really I don't know who they might be, but I assume that many of their descendants are here with us. So I'm going to start by giving a little bit of background about vaping and e-cigarette use. I'm going to use cigarettes and vaping interchangeably because essentially they are words for the same things. Often the term vaping was coined by industry to avoid connotations related to cigarettes. So it's actually there's a lot of variable terminology, but they do mean the same thing. I'll then talk a little bit about the regulatory situation internationally and including in Australia, and then talk about how we are going and monitoring of e-cigarette use. And I was asked to particularly talk about youth, so that's where the emphasis is in this talk, and then talk a bit about implications. There will be time for questions at the end, and I love questions, so don't hold back, please. So in terms of just the beginning, a bit of perspective, we have to be really clear that the main thing we're aiming for here is really effective tobacco control. We also know that the business model of the tobacco industry is products that are highly appealing and highly addictive that are then targeting young people, children and adolescents, because there's a window of opportunity where the brain is still plastic to generate that addiction, which then leads to a lifetime of addiction. And that is combined then with aggressive promotion of products. Now, there's quite a big overlap between the tobacco industry and the vaping and e-cigarette industry. They're not identical and there are some different players, but every large multinational tobacco company does also have its vape equivalent product. We have to remember that conventional smoking is really the elephant in the room here. It is, for us, it's our number one killer. I know that in Scotland, it's our number one killer. It's responsible for more than 8 million deaths every year. And also, not just those statistics, but every family has lost someone, and every family has had a member of their family suffering from smoking-related illness. Now, we know that tobacco control is achieved by essentially decreasing uptake of smoking and by increasing quitting in people who are established smokers. And as tobacco smoking prevalence goes down, so what we've seen in Australia, what we see in Scotland, it's increasingly driven by reducing uptake in youth. So it's not only about preventing harm to future generations, it's also about how we control tobacco overall. We also know that there's almost universal regret among people who smoke, and it is a distinct product in that 80 to 90% of people who are smoking are doing it because they are addicted. So it gets dressed up as personal choice by industry, but once you've got addiction in the picture, that really means people are not able to make a personal choice about it. They're doing it because they're addicted. We know what works for tobacco control, and the Empower framework captures that within the Empower sort of mnemonic within the framework convention on tobacco control. But if we're looking at sort of in order of effectiveness, the price and bans on advertising, promotion and sponsorship, smoke-free spaces, mass media, and then there's health warnings and individual support for quitting. But we need to remember that 2/3 to 3/4 of people who quit successfully do so unaided. So we also know that really the ideal situation is not to be addicted to nicotine, and it's not to be using either product. It's not to be using e-cigarettes or tobacco products. So that's really what we're aiming for. And we're also aiming for, addiction, nicotine-free young people. Now, I've drawn a little person doing a trick here in the corner, which is just to remind me that one of the main things that the tobacco industry does is to really be quite deceptive about what it's doing. It will say it's doing one thing and then it will do another thing. So we have to be really careful to distinguish between what the tobacco industry says and what the associated industries say and what they actually do. So this is a slide designed to give you a population perspective about nicotine products and smoking. So this whole rectangle represents the size of the Scottish population age 16 and over. And it's assuming around 15% currently smoke based on the Scottish Health Survey from 2022. So the people in the blue are people who are not currently smoking. I've got the blue because of like the blue sky. Just imagine they're breathing fresh air. The column on the right is people who smoke. And around 30 to 40% of people will make a quit attempt in a given year if they smoke. I was unable to find statistics on the proportion making a quit attempt in any given year for Scotland, so I've used Australian figures, but the statistics are that at least 70 to 80% of people who smoke will have made a quit attempt at some time. But let's just assume this is recent quit attempt is 30 to 40%. And of those who make a quit attempt, based on Scottish Health Survey data, around a third will use some form of aid to do that, some form of medication or nicotine replacement therapy. So they're the people who are actually using individual assisted cessation. So when we're thinking about policies and we're thinking about how we balance up the different needs in our population and what we should be thinking about, we need to think about all of these population groups. We need to be thinking about supporting the people in this right-hand column to quit, at the same time as really protecting the health of the people who are in that big blue square. So it'd be no good having a policy that really adversely affects everybody. You really want to avoid trade-offs against one or the other, but you also need to be clear that the people who are not currently smoking are our future, and they're people and they include the young people. At the same time, we have to appreciate that there's a huge amount of health adverse health effects on health that are caused by smoking, and we have to support this group on the right to quit. So you can see that balancing act, but you can also see the scale of the balancing act. And I think one of the things that we talk about with e-cigarettes is e-cigarettes can help established smokers to quit, bearing in mind that the majority will quit unaided. But we have to make sure that whatever we do to support that group to quit, we're not compromising the health of the people who don't smoke. I've actually engineered this for Scotland because you can do it for any country based on the data, but I'm very happy to leave this here with Ash Scotland if they'd like to use it. So when we think about e-cigarettes, they're not one product. They're really a huge range of products. They're invented, the modern ones were invented around 2003, and they've been on EU and US markets since 2006. And they are a very wide range of devices that change over time. And there are many thousands of chemical combinations that are in the emissions. They will generally include propylene glycol, vegetable glycerin, nicotine, and flavouring. So it's evolved through these sort of original cigalikes, 2 vape pens, box mod, vape pod, and then we've got this new generation of disposable products as well, which I understand Scotland is moving to ban. Is that right? Yeah.
Ban from the 1st of June this year.
From the 1st of June. Okay. So these contain largely, particularly the disposables, use nicotine salt form of nicotine, which is much more palatable and reduces throat irritation and allows the delivery of very high concentrations of nicotine. So this was a wrapper that I found outside my daughter's school, and you can see it's bubblegum flavoured. It's got sweets on the front of it. And it's actually the highest possible concentration. And just that one little pod contained the nicotine equivalent of 9 packets of cigarettes. So they're very, very, and that's actually quite an early generation one. There are now ones that are have much greater capacity. So, and these do exceed the regulations that you would have in Europe about it. So they're very easily concealed, and they are really marketed at youth. So the high concentration nicotine salt products have been seen as a key driver of the youth epidemic of use. And they are a big, the commercial success is related to this being both appealing and highly addictive, and obviously accessible as well. So here are some more recent ones that are more like 20 packets of cigarettes in terms of the nicotine capacity. And they were confiscated from a school a colleague is associated with. So in terms of what is in the e-cigarettes liquid, so there's nicotine and then there are other components. And what they what they do, so the way an e-cigarette works is there's a liquid inside it that is heated to a fairly high temperature, but it varies. It's from like 100 to 400 degrees. And then they deliver many thousands of sort of highly variable chemicals to the user. So there's a sort of list of all the different things that have been found in e-cigarettes. But there's a recent article where they actually characterized everything that was in a small number of products, just 4 products, and found more than 2,000 different chemicals, but most were unidentified. So you can see that there's this wide variety of possibilities in there. The Australian government work identified 243 unique non-nicotine chemicals, and 38 were listed poisons, and 3 exceeded the standard cutoffs. So there is this thing that there's some of the components have been shown to be toxic, some are not toxic, and most have unknown effects. And the group that is broadly responsible for flavourings in food has distanced itself from the use of those flavours in e-cigarettes, saying that we have shown these to be safe in food, but not to have been heated to a high temperature inhaled. So there's a lot of unknowns there. In terms of nicotine, almost all e-cigarettes deliver nicotine. So there really isn't much market for the non-nicotine products. And we know that nicotine is one of the most addictive substances known. And there's clear evidence that it's extremely addictive. And addiction can occur quite rapidly, especially in children and adolescents. So we know from qualitative work that children and adolescents are concerned about addiction, but they don't really understand what addiction means. So you will hear in sort of various interviews, they'll say, I'll quit before I get addicted. Or they will feel ashamed if they're addicted, and there will be stigma within social groups about becoming addicted, even though it is a natural consequence of using nicotine. So apart from addiction, and I really think it's very important we don't underrate addiction, nicotine itself, if it's drunk, can be is highly toxic, and some of the higher concentration products can be fatal. So there have been a number of fatalities, including one in Australia from accidental drinking of e-liquids. And then there's increased heart rate, increased blood pressure, there is a potential for increased cardiovascular disease risk, and there is considered sufficient evidence of adverse fetal and maternal effects, including low birth weight, prematurity, and stillbirth. I think one of the things we have to note there is that a lot of the evidence about nicotine is in pregnancy relates to smoking. So distinguishing between effects of nicotine and effects of smoking is difficult, but this is from the report of the Surgeon General. Effects on brain development in childhood and adolescence, and then there's more recent evidence on potential immune suppression. So in terms of, I think one of the other things about, if you're thinking about any sort of product, the effect it has on health will depend on how it is used and who uses it. So one of the things that has happened with e-cigarettes is they are very aggressively marketed at young people. And this is what I mean by the industry saying one thing and doing another thing. So they will bring it into a community and say, this is to help adult smokers to quit. And then there will be products that are by design appealing to youth, and there will be aggressive marketing towards youth. And that has been documented to the extent that Juul actually has had to pay hundreds of millions of dollars in fines for that. We know that youth use has increased rapidly and is greater than adult use in a number of countries. So if you look at on the right, the Australian population ever use of e-cigarettes, it's heavily skewed towards the young people, even though the smoking is more skewed towards the older people. And most of the use that we see in Australia is not for smoking cessation. So if you look at the proportions of people who are using it, if we think use in people who've never smoked is not for smoking cessation, use in people who continue to smoke is dual use, and use in people who've smoked in the past may be used for cessation. But the most of the use is either dual use or use in people who've never smoked. There are people who are ex-smokers who are using e-cigarettes, and that would be the more favourable thing. So what we're seeing is actually a mixture of use patterns. So if we look at recent data from 11 to 17-year-olds in Scotland, which is from the ASH Great Britain survey, we're looking at about 8% current vaping, and there's some graph from those data from 2024 there. So you can see that it increases with age within that within those teenage years, and the current vaping is up to about 17% in the 17-year-olds there. But I think the numbers are quite small in that survey, and I think one of the things that we can make a point of here is that it's really, really important to have good data for monitoring, and that's lacking in many places. So I'm just going to talk about vaping and smoking cessation, and then we're going to talk about smoking uptake and a bit of the data about health effects, and then we'll talk to you about the Australian situation with regulation and where we've gotten up to. So as I've said, unaided cessation is the most common way of successfully quitting. So people might use multiple products in their most recent quit attempt, but if you look at people who have quit successfully and ask them how they did it, 2/3 to 3/4, it will have been unaided. Now, one of the most important things to remember is if you're talking about the use of a product for clinical practice, there's a kind of holy trinity of quality, safety, and efficacy. So products need to be of appropriate quality, and there's a lot of quality control in clinical medical products. It has to be shown to be efficacious, and it also has to be shown to be safe. Now, there is no currently available e-cigarette as a registered medical product, and although the companies will say this is for smoking cessation, they have not put their products through the medical registration processes, despite lots and lots of encouragement and, in fact, pleading with them, could you please put them through this? So there is a clear prioritization of a consumer product there. Now, we looked at systematic reviews of e-cigarettes for smoking cessation, and what we find there is that those reviews vary in their conclusions, and in particular, they vary in what they see as the certainty of the effects. So we reviewed the reviews, and then we reviewed the trials, and we identified 13 randomized controlled trials. What I think is important to remember is even under these trial conditions, the quitting in the e-cigarettes group ranged from about 8 to 14.5% in our summaries, versus 5 to 8% in the comparison groups. So I think when people hear that something is good for smoking cessation, they tend to then think, oh, that means the majority of people would quit if they used this product. Now, it's really hard to quit smoking. You actually have to often try multiple times, but it's really important to bear in mind that the vast majority of people who use the e-cigarettes in these trials will not actually have quit by the end of it. But that, these are actually good outcomes a lot of the time for those trials. If we look at the most recent randomized trial systematic reviews that have used GRADE, that means they've actually looked at the certainty of evidence. 3 of those find there is low certainty evidence that e-cigarettes are more efficacious than nicotine replacement therapy. 1 finds moderate evidence, and 1 finds high certainty evidence. Now, the high certainty evidence is the Cochrane review, which a lot of people cite, but I think it's really important to remember that there's a plurality of ways of interpreting that. Those systematic reviews do actually tend to find the same overall summary relative risk of quitting, so about 70 to 80% more quitting in the e-cigarette group compared to the comparator of nicotine replacement therapy. But where they differ is how certain they consider that evidence to be. What we do know is that these trials are almost all in the trials that show efficacy are all in clinical settings, and they all use free-base nicotine at relatively low concentrations of less than 20 milligrams per mil. There's no current evidence that's on nicotine salt products. There was one trial published as an abstract from a conference that was had industry connections, so that wasn't included in the trials that we looked at. And the other thing to remember is that most people who smoke, who are randomized to e-cigarettes, will continue to smoke. So we also see that in those trials, for each person who might quit using e-cigarettes, there will be also people who then become dual users who continue to smoke and use e-cigarettes, and they would tend then to be exposed to the risks of both products. So that's smoking cessation. So I think the conclusion from the smoking cessation work is that we know that e-cigarettes can help some people who smoke to quit. But that has to be also the name of the game. It's not about dual use is an adverse outcome. It's not a positive outcome. So it's about people using e-cigarettes to quit and ceasing smoking promptly and completely. Then if we look at smoking uptake, so this is looking at young people who vape and then looking at who goes on to smoke. We did a review and identified 25 observational studies across multiple countries and concluded that there was strong evidence, because every single one of these studies showed a significantly greater smoking uptake in people who used e-cigarettes compared to people who didn't. And it was around threefold on average, although it did vary. And that persisted following adjustment for multiple factors. We then looked at whether this relationship was likely to be causal, because there are people who would say, well, the types of, there's a thing called shared liability, and the idea is the types of people who would vape are also those who would go on to smoke. But when we looked at the criteria for causality, we concluded that this is likely to be a causal relationship. And I think one thing that we would say is that if you are addicted to nicotine from one source, you are more likely to go on to use that product in other preparations. But also you have started to get what they call the hand-mouth movement of using something that's like a cigarette, and that you would have more likely to normalise that behaviour. As well, young people who use e-cigarettes are more likely to be exposed to tobacco marketing than people who don't use e-cigarettes. We also found limited evidence, so not strong evidence, limited evidence that there was an increased risk of relapse in ex-smokers who used e-cigarettes compared to ex-smokers who didn't. So in terms of health outcomes, we reviewed this we have a 400-page report that has been condensed down into a paper, which I'm very happy to share a reference to. One thing we would say is that the data, in terms of really strong, longitudinal follow-up data, are quite limited, and that doesn't mean there's no risk. It means we haven't actually established the safety for a lot of these outcomes. And I've highlighted in red the outcomes which are common and serious. I think some of these outcomes are actually not common. They can be serious, but they're not common. So we found conclusive or strong evidence that e-cigarettes can lead to addiction, and they can lead to increased uptake of smoking in non-smokers. We also know that they can lead to poisoning, both accidental and intentional. This is uncommon. Toxicity from inhalation, or people becoming what they call nic sick, losing consciousness, that's often from nicotine naive people trying it for the first time. Injuries and burns can happen from exploding batteries, and there have been fatalities. They're quite uncommon. I think that there's an estimate from the US Fire Services that around 800 injuries or burns from e-cigarettes would happen in the US per year. There's also lung injury, and the e-cigarette or vaping-associated lung injury epidemic, which peaked in September 2019 and then gradually subsided. It was largely attributed to e-cigarettes where THC and vitamin E acetate had been used, although not exclusively. And when we look at the case reports for EVALI outside of the US, they are largely reported to be using conventional products. We also know there's very strong evidence that there are adverse environmental consequences of e-cigarettes, particularly in terms of waste, but also, and we're particularly concerned about this in Australia, fires. And I can say that in Canberra, we've been sending our recycling to Sydney for quite a long time due to a fire at the recycling depot, which the investigators have said they considered most likely to have been caused by a vape. There's moderate evidence of common effects of cough and throat irritation, and some adverse cardiovascular measures like raised blood pressure and heart rate. And then there's limited or indirect evidence regarding nicotine effects on the developing brain, reductions in lung function in non-smokers. There have been more recent reviews that have found evidence of lung inflammation, increased cardiovascular disease, stroke, diabetes, and as I've said before, dual use. Because we didn't include in our review cross-sectional data, So we didn't find the same things, but when a broader view of the data have been used, those are the conclusions. But I think one of the most important things is if we look at clinical outcomes like cardiovascular disease, cancer, mental health, a big long list there, we don't really have much evidence about what e-cigarettes do. So when I talk about that, this is about the health effects of the e-cigarettes themselves, where the comparator is people who have neither smoke nor use e-cigarettes. So the comparison here is not e-cigarettes versus smoking. And I think it's really important that we make sure that we're clear about that. So I often hear people say, oh, yes, but are they safer than smoking? And that's not the question here, because such a large number of users are actually people who don't smoke. But also that comparison is comparing to one of the most dangerous things that we know. And the other thing is there are many other ways to quit smoking. So it's this sort of, it's used as a way of, in a way, creating a false standard. Because, drinking half a bottle of vodka a day is, in terms of mortality, is safer than smoking. It doesn't mean it's a safe thing to do. The other thing is that people who smoke have the right to expect safe smoking cessation measures. So anyway, this is very much in terms of what are the health effects that you can distinctly attribute to e-cigarettes in relation to not using e-cigarettes. So it's not about the comparison with smoking. So I wanted to just take a moment to talk about addiction. I think we tend to trivialize addiction. We'll say, look, I'm addicted to chocolate, guilty as charged, or I'm addicted to a particular streaming service, or addicted to particular. But I think people don't have a sense of what it means to be addicted to something. In a sense, being addicted removes the sense of choice about something, and children and adolescents are more vulnerable to addiction. And what addiction means is that you only feel normal when you actually, or okay when you have the drug on board or the substance. And after a while, you'll then go into a kind of cycle of withdrawal where you have the withdrawal symptoms and the craving. So if we look at nicotine withdrawal, one of the things about nicotine is there are very unpleasant withdrawal symptoms, and that's part of what drives the addiction. In fact, a big contributor. So nicotine withdrawal is characterized by irritability, and they call it anhedonia, but like feeling just terrible, depressed mood, restlessness, anxiety, difficulty concentrating, and it can be very intense disturbances of mood. The primary pleasure in smoking has been established as being mainly about relief from withdrawal symptoms. So if people say, well, it relaxes me, it's because withdrawal symptoms will cause you to feel terrible. And addiction is a very common effect of e-cigarettes in youth. So if we look at the ASH Great Britain survey of 11 to 17-year-olds, around 50% of e-cigarette users in that would say that they have strong or moderate cravings to vape. And we also know that the majority of young e-cigarette users are now saying that they do want to quit. So so there is also a need for support for those. But the other thing about e-cigarettes is they tend to mean people are often using a sort of grazing pattern of vaping. So they'll be vaping a lot over the course of a day. It's not like with a cigarette where people will smoke one and then have a break and then smoke another one. There's often a pattern of using it, small numbers of puffs, but quite a lot during the day. So then there can be difficulty concentrating and sitting through a class. And people often have them under their pillow at night for that reason. But obviously it does vary. Some people only, there's a variety of whether people vape every day or whether people are using it occasionally, but there is emerging a significant pattern of people who are dependent. So if we put them all together, if you think back to the rectangle, there's a need to consider different population groups when it comes to vaping. If we look at people who don't smoke, and particularly people who are youth, then the consequences of e-cigarette use are adverse because the alternative is breathing air. And we know that breathing e-cigarettes will be adverse. They also tend to be adverse if they're used for purposes other than smoking cessation. people who smoke may benefit if they switch promptly and completely to the e-cigarettes, bearing in mind the uncertainty about the long-term effects. So that's just the likelihood. These are not registered products, and we need to recognise that dual use is also not a good situation. It tends to result in being exposed to the harms of both products. So if we look at the whole population, use by the whole population without targeting, that's unlikely to be beneficial because it's including people for whom the effects, large group of people for whom the effects are adverse. And then for the group of people who are using them for cessation, there's a minority who would benefit. The other issue is that there are risks to tobacco control itself from e-cigarettes, both because of increasing smoking among young people, but also because they are used by the tobacco industry to gain a seat at the policy table and to as part of a sort of pseudo-redemption narrative that they are a big part of the solution while continuing to oppose tobacco control legislation and measures, and also while continuing to profit from tobacco. So if we look at non-nicotine e-cigarettes, there's really no potential benefit there either. So I think that really it's hard to disagree with the idea that we need to avoid use in non-smokers, especially youth, and that any use needs to be effectively targeted at smoking cessation. So this then begs various policy problems. One of the main ones is that we have very predatory industry that has virtually limitless resources, and I'm saying zero scruples. This is my view. They're also very good at manufacturing doubt, so creating uncertainty. And what they do is they would promote for these products for smoking cessation when there's, to some extent, an unclear risk benefit. And in fact, the US Preventative Services Task Force has concluded that e-cigarettes should not be used for smoking cessation because you can't actually weigh up the risks and benefits because of the uncertainties. But the other thing is that most use is not for smoking cessation. And the large majority of people who smoke, who use them, don't quit, alongside aggressive marketing to youth, which is underpinning renormalisation. And even where there is regulation, we do end up with quite a lot of use among youth. The other thing is that young people think that availability equals safety. So you will often hear young people say, well, if they weren't safe, why would it be so easy to get hold of them? The other thing is that I think we can mistake, like there is this sort of, there's a perspective that because this helps an individual, this may have helped an individual, that if you scale that up, that equals public health. But public health is about thinking about lots of different populations. It's not just about the one sitting in front of you. So it is clear that e-cigarettes can help some smokers to quit, and we'll all know people for whom they've been quite beneficial. But then you don't see in that the people that they haven't helped to quit and the young people and the non-smokers who have entered into addiction through them. We do know that there are difficulties in restricting or targeting use, largely because of industry activities, but we also know that youth use is lower in countries that ban e-cigarettes. What we also know is that there is variable and limited enforcement. So what we need to do is make sure that we, as people who are working on regulation, don't get distracted by e-cigarettes, because on one hand, we need to focus on conventional smoking and really making sure that we're going as hard as possible there and not get distracted by e-cigarettes. But on the other hand, we have to do enough about e-cigarettes to not have that be a problem as well. So we want to avoid a win-win for industry. So what does the sort of world look like in terms of e-cigarette regulation? I often hear people say, well, in Australia, you're totally draconian, like you're sort of crazy. But actually, 39 countries have laws which prohibit e-cigarettes as consumer products. Australia's there actually as one that prohibits e-cigarettes as a consumer product, but actually our more recent regulations are that they are for sale in pharmacies behind the counter. So we're not even in that group. And then there are a number of, and that covers about 41% of the global population, lives in countries where e-cigarettes are banned as consumer products. On top of that, there are countries which ban flavoured e-liquids by law or practice. So that you can see includes China. So China exports the vast majority of the world's e-cigarettes, but in fact bans all flavours except tobacco because of concerns about youth vaping. So regulation in Australia. I just want to note that that e-cigarettes represent a national and international challenge to regulation. I think we're all struggling with it. In Australia, we have a federation, so we have state laws and federal laws, and the laws that relate to, and the enforcement of laws are kind of heady mix of those different legislative frameworks. We had a range of changes to legislation relating to vaping that really started in 2020 and have continued all the way through, but particularly in 2024. So prior to 2024, nicotine e-cigarettes were a prescription-only product. They had been, prior to that, on the poison schedule, so they are poisoned. And so it's quite a different regulatory framework in the UK. And non-nicotine e-cigarettes were a consumer product. And this created a lot of enforcement issues, because in order to establish that, there were a lot of things that were just not labelled as nicotine containing that were nicotine containing. And it was difficult to test those products. And there was quite a significant illicit market. So during 2024, there were a number of different measures put in place. I've just summarised some of them, but if you want to look at the legislation, look on the website. It's really out there. There's a ban on single-use vapes, and then vapes any kind, nicotine or non-nicotine, were only supplied through pharmacies and behind the counter. It was illegal to supply vapes through vape shops, convenience stores, and that sort of thing. And then there were a range of product standards introduced. So pharmaceutical packaging, it's kind of the plain packaging equivalent. Nicotine concentrations of 20 milligrams per or less for pharmacy supplied. You can have a higher concentration on prescription. Restriction to tobacco, mint and menthol flavouring, childproof packaging, and then a range of permitted ingredients. So rather than saying these ingredients are not permitted, there was a list of the ingredients that were permitted, because of the things that people have been adding to e-liquids. And then restrictions on advertising, promotion and sponsorship. But, that's just some examples. So how are we going? Well, the first thing to say is that in terms of getting data for Australia nationally, it's really challenging, because most of the surveys that are representative are biennial or triennial. And e-cigarettes and smoking, they're actually changing much more rapidly than that. We have general population and school samples, and I would like to say big shout out for the need for more responsive data collection, but we do have subnational and smaller samples, particularly done through the states. But if we're just looking at our most recent data, 2022-2023, which is from the National Drug Strategy Household Survey, we can see really quite rapid increase in current use of e-cigarettes from you can see the numbers there. And then you can also see ever uses going up as well. So we've had quite a lot of increase in use, and it looks like sort of around the time of the pandemic was when things really took off. If we're looking at vaping in school students, so this is a really beautiful paper by Beth Greenhill and colleagues, looking at national estimates, because quite often we were finding people say, well, the Australian way of dealing with things has completely failed and you've got this rampant illicit market. And it is true, we have an illicit market, but it's been quite difficult to get data to compare like with like. So this is where Beth and colleagues have really carefully identified studies where you can look at age 14 to 15 years, and based on reasonably large numbers. If you look at the numbers there in that selected age group and sample size, you can see that those are large numbers. And if we look at Australia, we have about 26% ever use, about 13% past month use, but daily use is around 3%. And people often compare Australia and New Zealand. They're quite an interesting natural experiment, because New Zealand really has been very favourable towards vapes, and they're very, very widely available. And they've got around 10% of their 14 to 15-year-olds using e-cigarettes daily overall. Higher prevalences among Maori students. Then if we look at the US, you can see the statistics there, and then Canada's around 8%. They were not able to get exact corresponding data from England. They've got down to weekly use is about 10% and ever use is about 42%, which does suggest higher prevalences as well. But it's the paper's actually got in the title the importance of comparing, how important it is to compare like with like, but also to really make sure that when people make statements about things that are working and things that aren't, that it's based on evidence. And one thing industry does not want is examples of things that are working in tobacco control. So they work quite hard to discredit things, and they will make sort of throwaway statements like the failed Australian model or without necessarily looking at the numbers. So, and I would add to this that smoking in Australia is actually also tracking down very well. So we are now at 8.3% current daily smoking in Australia in people aged 14 and over, and we have particularly low smoking prevalence in children and adolescents. So there was also statements that what Australia's done has meant that smoking's out of control. And my talk this morning was all about actually smoking prevalence, that we actually have, we're tracking reasonably well. We do have an issue with the illicit market of tobacco, like other countries. In fact, controlling illicit trade in tobacco is part of tobacco control. But it's, if anything, similar to the UK in terms of the proportion of the market that is illicit, based on the latest data that we have. But if we look at current use of e-cigarettes by age in Australia in 2022 to 23, this is by age group. And what you can see is that the bulk of the use, if this is the proportion of e-cigarette users who are in each age category, and you can actually see that the bulk of the use is really age 14 to 30. It's in young people. And if you then look at that broken down in terms of who of current smoking behaviour, bearing in mind this is not smoking behaviour at initiation of vaping, this is current smoking behaviour, but you can see that the proportion who have smoked is much higher in that younger age group, and actually the vast majority of people in the younger age groups actually had never smoked at the point when they initiated e-cigarette use. But you can see that it starts off being about in this 50% never smoking, and then actually when you get up to 60 years, it's mostly either former or current smokers. But you can also see what the picture of dual use looks like, because those people who are currently smoking are currently smoking and using e-cigarettes. So what are some early findings following on from these reforms in 2024? So Generation Vape, this has been published, and this is some early indicators from Professor Becky Freeman and colleagues, looking in the Generation Vape study, which is national. It's a cohort study, so it's not designed to be representative, but it's just to let you see comparisons. And what you can see at the top is the number of respondents in each wave, the proportion who have never vaped, and then the proportion who vaped on fewer than 10 occasions, but they have to have had more than a few puffs. So people who've only had a few puffs were included in the never vapor category. And then you get up to 100 occasions. So if you look at the never vapor column, what we can see there is actually the proportion. So between wave 6 and wave 7 was when the 2024 reforms happened. So it's really about comparing wave 6 and wave 7 on this. And you can see that the proportions who had never vaped actually went up between those two surveys, and the proportions who had particularly used e-cigarettes on multiple occasions has gone down, and that was statistically significant between those two. The implications of this are really that we need to both accelerate standard tobacco control and think about e-cigarette control. And we also need to maintain our perspective on e-cigarettes. They can be helpful for people to quit smoking, but they are also highly addictive and are made to be appealing to children and adolescents. And we also know that there are many ways to support people who smoke to quit. We really applaud the kind of quit your way kind of message, and that the next generation is actively targeted by industry, and we have an opportunity to prevent that. And any approach needs to pragmatically work in the face of industry activities, and that enforcement and implementation are crucial. Anyway, these are some ducklings at the Australian National University. Just to reassure you, it is not a hellscape. It is not a. It's not a. I mean, I suppose you could have ducklings still in a draconian setting, but anyway, just to say that it's really important. Whatever messages you're getting, we should make sure we are learning from each other. We should make sure that we're getting the balance right. We also know that this is a shared challenge, and nobody really has it completely worked out. So we can learn a lot from each other. Thank you.